Have you ever heard about the cancer? One of the deadliest diseases in the world, who only got 69% level of survival based on American Cancer Society. And today we're going to talk about one specific cancer called the lung cancer. This cancer represents 11.6 new cases out of 18.4% death caused by malignant tumor. And this number shows us that this type of cancer aren't just a common cancer, but one of the deadliest forms of cancer. And this number are predicted to be increased by next year. Now, while medical treatments such as surgery, chemotherapy, and radiotherapy has advanced significantly in the past few years, they are often accompanied by side effects, or one might say a swelling. Many patients experience fatigue, reduced lung functions, difficulty in breathing, and even pain. All these challenges affect their daily life and overall quality of life. That's why supportive care plays such an important role in patients with recovery. Today I'm going to talk about how breathing therapy can help patients with lung cancer. Hi, my name is Olivia Yuniar Azzahra. I took a master in physiotherapy, and today we're going to talk about the breathing therapy. This therapy might not cure the disease overall, but this therapy can reduce the symptoms one may always have. And how do we do this? First, put yourself in relaxed positions like this. I will count to 3 and we'll do the inhale together. After we do the inhale together, hold it for 3 seconds. And after we hold it for 3 seconds, do the exhale with the halfings, or breathe through your mouth for 3 seconds. Okay? First, we're going to practice. 1, 2, 3. Do the inhale. Hold it for 3 seconds. 1, 2, 3. And do the exhale. Don't forget to do the halfings with your mouth. Okay, let's do it again. 1, 2, 3. Do the inhale. Hold it for 3 seconds. 1, 2, 3. And do the exhale. Again, let's do it together. 1, 2, 3. Do the inhale. Hold it for 3 seconds. 1, 2, 3. And do the exhale. Don't forget to do the halfings with your mouth. Let's do it again. 1, 2, 3. Do the inhale. Hold it for 3 seconds. 1, 2, 3. And do the exhale. This therapy consists of 3 forms. First, the breathing control. 2, the thoracic expansions. And 3, the halving or the forced expirations. First, the breathing control. This type of therapy, the breathing control, used for the reduced airway spasm. Second, the thoracic exercise. In simple words, it allows air to move into smaller area of the lungs that may be blocked by mucus or fluid. By practicing these deep breaths, patients can mobilize secretions, keep the lungs more open, and reduce the risk of infections. The third, on the last one, is the forced expirations we do with our mouth, or the huffing. More commonly known as a huffing, this is a sharp breath out through an open mouth and throat, similar to the way you will fuck up a neighbor. Huffing helps move secretions from the lungs toward the throat, where they can be cut off more easily. After the huffings, if secretions reach the upper airways, patients can follow with a gentle cough to expectorate them. What's important is that patients learn to cough in a controlled way, without exhausting themselves. No one might ask when this therapy will be used. Interestingly, physiotherapy interventions like the breathing exercise are not limited to the recovery phase after the cancer treatment. They can be applied at multiple stages before surgery to prepare the lungs, during chemotherapy or radiotherapy to manage side effects, and after the treatment to restore the functions. Research has shown that the patients who participate in physiotherapy programs often experience less fatigue, better lung capacity, and improved quality of life compared to those who do not. To conclude, lung cancer is a tough journey for any patient, not only because of the disease itself, but also because of the impact of the treatments. Breathing therapy might seem simple, but it provides powerful benefit. It helps reduce symptoms, supports lung functions, and gives patients a way to actively participate in their own care. As a healthcare provider, family members, or even field professionals, we should encourage and support this type of therapies.